This was from January, when Barking and Dagenham in East London had one of the highest COVID rates in the country. In the space of just 2 months, that has fallen dramatically. And it's falling elsewhere. Lockdown, vaccines and public compliance all having an effect. And it would seem this is the moment for Downing Street to celebrate.
We were on a mission, and the mission was to get vaccines for the UK.
A promotional video released today on social media ahead of a longer film on the vaccine development and rollout.
I'm thinking, yes, there's a way out of this.
What is not the subject of the celebratory film is England's Test and Trace system. A Public Accounts Committee report today finding no clear evidence that it has reduced infections, and all at a cost of £37 billion for this financial year and the next.
It's eye-watering sums of money, and I think the question that the government's got to answer is what is Test and Trace designed to do, and what is its long-term plan? Because you can't keep putting taxpayers' money in at this volume unless you can be sure what results you're getting, and that's the bit that was missing for us in our inquiry.
The committee acknowledges the sheer scale of its testing and contact tracing, but said improvements need to be made if we are to avoid further lockdowns. The recommendations are improving the data Test and Trace publishes, including the total time it takes to reach contacts, a better match of supply and demand so it's not paying for surplus capacity, and less reliance on expensive contractors and temporary staff. A reference to 2,500 consultants still employed in February at an estimated average daily rate of around £1,100.
Over 80% of the costs of NHS Test and Trace are tests. So the more tests we do, that drives the cost. And the remaining 20%, over £1 billion, has gone to local authorities to support the work that local authorities do to support people when they're isolating and to manage local outbreaks.
The timing of this report is difficult for the government as it faces ongoing criticism over its 1% pay offer to NHS staff.
Test, trace and isolate was going to be such an important part of us preventing a second wave last summer if it had been done effectively. It's such an important thing going forward in terms of keeping populations safe, and yet it's been managed really poorly. And actually, I've done the sums today. The other thing that we're pushing for at the moment is a pay rise for NHS staff, and the cost of this programme over the next year is going to cost more than giving that 15% pay rise to every member of NHS staff in the UK who've been working so hard and delivering a vaccine programme which everyone agrees has been phenomenally successful.
Lateral flow tests rolling out in schools. Today, the Department of Health published research saying it is highly unlikely they will tell students they have COVID when they don't. Some experts have disputed the findings, but under the rules, parents won't be able to double-check this by asking for the more common PCR test. Bad news for those who may have celebrated their kids' return to the classroom too soon.
Well, the sums of money consumed by the Test and Trace programme in England are mind-boggling. Our economics correspondent Helia Ebrahimia is in the newsroom now. Helia.
Well, there's a bigger question here about government spending and waste, Jackie, because this comes hot on the heels of the £15 billion of PPE contracts, which raised questions not just about value for money, but also about transparency and cronyism. But let's look at those Test and Trace England numbers first. We know £22 billion has already been spent. That includes the £7 billion on Dominic Cummings' moonshot idea. Then you've got the extra £15 billion from last week's budget. Government contract data shows that 226 separate contracts have been awarded to management consultants, most notably to the Big Four accountancy firms, with some consultants being paid more than £6,000 a day. And if we take the question of waste here, Jackie, you only have to look at the £720 million of contracts awarded for call centres, because here call handlers have worked just 1% of the time that they've been paid to work for. And perhaps that's why you had this rather unusual outburst on Twitter from the former Treasury boss, who described Test and Trace as the most inept and wasteful spending programme of all time.
So do we know any of the details of these contracts?
Well, Labour say that despite the Prime Minister's assurances, 100 contracts have still not been published, and details do matter here. The government is refusing to answer questions that have been posed by this programme about companies being put on a so-called high priority lane, delaying our inquiries 3 times now. 47 companies that have been given contracts worth billions of pounds have somehow been spirited onto this VIP lane, but we still don't know exactly who they are and exactly why they were given preferential treatment.
And does this matter to the wider public finances?
Well, let me give you just one example of why this matters. Because if you take the Test and Trace budget for last year alone, you could have given a £14,000 bonus to every single NHS worker in England. So these aren't marginal numbers. It's vital at a time when the government is talking about raising taxes and cutting costs and tackling our monster deficit that we make sure money isn't squandered.
Elliot, thanks very much.